Hi everyone, my name is Katerina.
And I'm Anthony.
And we here at CGHI are interviewing Dion Ras. Dion Ras has been shaping the conversations on a global level regarding youth mental health. And we're really excited to be speaking with them here at the World Health Summit 2025 in Berlin. So Dion, thank you so much for being here with us. We really appreciate your time and all of the work that you've been doing. So just to start off the conversation, what inspired you to dedicate your work to youth mental health?
That would be actually my personal experience, my personal lived experience. I myself have lived with mental health issues for quite a bit, from when I was about 10 years old to when I was about 19. I suffered from depression. And so I myself know what it's like, and I wanted to make sure that other people that were in my situation don't experience the same kind of, suffering that I had. And then beyond that also, I suppose peer support was one thing that kind of got me into this whole space. In wanting to make sure, that I can help other people that experience the same things, I also went out and learned, I suppose, that it's very fulfilling to try and help other people. And I guess through that route, I ended up here.
Dion, inclusion is at the heart of sustainable mental health advocacy. What does an inclusive mental health system look like to you, especially for underserved youth communities?
I suppose there's quite a few answers to that question. One of them would be accessibility, so that, for example, through community-based mental health care methods that are integrated into primary healthcare, even those that are underserved or marginalized can access mental health care. And I guess a second part to me would be the engagement of people with lived experience in shaping those methodologies and shaping services and the policies that affect them as well.
So Dion, mental health solutions are evolving with technology and creative approaches. What's exciting you the most when it comes to improving access and equity for youth mental health?
Well, I mentioned peer support before. That is honestly my passion. I guess that would be my answer as well. Community-based mental health approaches are something that's extremely valuable in increasing accessibility for marginalized groups to vulnerable groups like young people. There's a number of examples out there right now that have also in fact been integrated or are being integrated into primary healthcare. So we see integrated youth services in Canada, for instance. We see Headspace in Australia. Another example, although not integrated into primary healthcare, would be At Ease in the Netherlands, which has locations all over the Netherlands, where essentially peer support workers offer support to young people in need of psychological support. And those kinds of, initiatives are something that I'm really passionate about. One thing that's also very valuable to mention, I would say, is that finally, in the political declaration, community-based mental health care has actually been mentioned, and there is it's listed on the commitments that scaling up is one of their commitments.
That is so exciting.
Yeah, absolutely.
Dion, you've worked with different international youth networks. Why is it so crucial for young people to always be at the decision-making table in global mental health?
I mean, that's a really great question. It's very important because I guess the very often named statistic in youth mental health spaces is that 75% of mental health disorders start under the age of 24. And I suppose, to sum it up in one sentence, there really is no global mental health without youth mental health. I think that about sums it up.
And finally, Dion, if you could leave people watching this with a final message about the future of mental health, what would it be?
I guess it could be summed up in one sentence, and that is nothing about us without us.
Thank you. That's a really great one sentence. And I guess finally, inclusion, youth, and innovation are definitely the future of mental health. And there is no future for mental health without all of those three. So thanks for watching. And
thank you very much. And thank you, Dion.
Thank you, Dion.